Welcome to part 2 of the circulatory system. Renal circulation. Renal circulation refers to the blood flow to the kidneys. It includes many specialized blood vessels and receives about 20% of the heart's total output. This circulation branches from the abdominal aorta and returns filtered blood to the inferior vena cava. Veins. During human development, the venous system forms mainly from three sets of veins: the vitelline veins, umbilical veins, and cardinal veins. All of these early veins drain into a structure called the sinus venosus, which later becomes part of the developing heart. Function. In healthy individuals breathing air at sea level, about 98.5% of the oxygen in arterial blood is carried by hemoglobin molecules. A small amount, roughly 1.5%, is dissolved directly in the liquid portion of the blood and is not bound to hemoglobin. Hemoglobin serves as the main oxygen-carrying molecule in vertebrates. Clinical significance. Many illnesses affect the circulatory system. These include cardiovascular diseases that impact the heart and blood vessels, blood-related disorders such as anemia, and diseases of the lymphatic system. Medical specialists in this field include cardiologists, who focus on heart conditions, cardiothoracic surgeons, who operate on the heart and surrounding structures, and vascular surgeons, who treat disorders of the blood vessels. Cardiovascular disease. Conditions that affect the heart and blood vessels are known as cardiovascular diseases. Many of these illnesses are considered lifestyle-related diseases because they develop gradually and are influenced by factors such as physical activity, diet, smoking, and other daily habits. Atherosclerosis is a common underlying cause of many cardiovascular conditions. It occurs when fatty plaques accumulate inside the walls of medium and large arteries. Over time, these plaques can grow, rupture, or block blood flow. This process increases the risk of acute coronary syndromes, which involve a sudden reduction of oxygen-rich blood reaching the heart muscle. Atherosclerosis is also linked to artery-related complications, such as aneurysms and arterial dissections. Another major group of cardiovascular problems involves blood clots, known as thrombi, which may form in either arteries or veins. Deep vein thrombosis commonly develops in the legs, especially during prolonged periods of immobility. These clots can break loose and travel through the bloodstream, leading to serious conditions such as pulmonary embolism, transient ischemic attacks, or stroke. Some cardiovascular conditions are present from birth, including congenital heart defects and persistent fetal circulation, where normal circulatory changes after birth fail to occur. However, many congenital differences in the circulatory system are harmless and represent normal anatomical variations rather than disease. Sphygmomanometer and listening to the heart with a stethoscope to detect murmurs that may suggest valve abnormalities. An electrocardiogram, ECG, is used to assess the electrical activity of the heart. More invasive procedures may also be performed when needed. Catheters or cannulas inserted into arteries can measure pressures within the heart and lungs. Angiography uses injected contrast dye to visualize blood vessels in areas such as the heart or brain, helping to identify blockages or narrowing. During these procedures, stents may be placed to open narrowed vessels, and bleeding vessels may be treated with coils. Advanced imaging methods include magnetic resonance angiography to view arteries, CT pulmonary angiography to assess blood flow to the lungs, and vascular ultrasound to examine blood flow in veins and arteries. Ultrasound techniques are commonly used to diagnose conditions such as vessel narrowing, blood clots, and venous insufficiency. In some cases, intravascular ultrasound using a catheter provides detailed images from inside the blood vessels. Surgery. Many surgical procedures are performed to treat conditions affecting the circulatory system. These include coronary artery bypass surgery, which restores blood flow to the heart, and angioplasty procedures that use coronary stents to open narrowed arteries. Other treatments fall under vascular surgery, which focuses on diseases of blood vessels, as well as vein stripping, a procedure often used to treat varicose veins. Some circulatory system procedures are also performed for cosmetic purposes. Most cardiovascular surgeries are carried out in hospitals where patients stay overnight rather than in outpatient or ambulatory care settings. In the United States, only about 28% of cardiovascular surgeries are performed on an outpatient basis.